The fluorescent lights in St. Louis Memorial's ER buzzed like trapped wasps. Dr. Lena Marquez stood at the charge desk, clipboard in hand, eyes scanning the triage board. It was 9:47 p.m. on a Tuesday that smelled like disinfectant and burnt coffee. Outside, autumn rain hammered the ambulance bay doors. Inside, the radio crackled with static and distant sirens. "Dr. Marquez, bed 7 needs a discharge signature," a nurse called out, not looking up from her computer. Lena didn't respond immediately. She was counting. 12 patients in the waiting room, 4 in trauma bays, 2 in isolation. The numbers had to balance. They always had to balance. That's what her father taught her before he died in a field hospital in Guatemala. Count everything, trust nothing, and never let chaos decide who lives. "Marquez?" The nurse's voice sharpened. "I'll review it in 3 minutes," Lena said, her tone flat and precise. "After I confirm the isolation wing's negative pressure readings." The nurse rolled her eyes. Someone at the nurse's station muttered something that included the word robotic. Lena heard it. She always heard it, but she didn't flinch. Robots didn't save lives. Protocols did. She walked toward Isolation Wing B, her white coat rustling against her scrubs. The hallway smelled different here. Sharper, chemical, like fear had a scent. 2 patients were behind the airlock. One suspected tuberculosis, one awaiting test results for something respiratory the CDC hadn't named yet. Both beds were tagged code yellow. Not red, not yet. Lena checked the pressure gauge outside the door. Negative 2.5 pascals. Standard. She logged it on her tablet. Then she checked the seal integrity. Green light. She logged that too. "Dr. Marquez, we've got an incoming." The charge nurse's voice boomed over the intercom. "EMS 2 minutes out. Fever, respiratory distress, recent international travel. They're calling it a possible quarantine case." Lena's jaw tightened. She tapped her earpiece. "Which country?" "Central Africa. Kinshasa layover." Her pulse didn't spike. It never did. But her mind did the math instantly. Incubation periods, airborne transmission rates, containment SOP. She walked back to the main ER, her steps measured, her face unreadable. The double doors burst open. 2 paramedics wheeled in a man on a gurney, his face slick with sweat, his breathing shallow and wet. He looked 40, maybe younger. His eyes rolled back. "Vitals?" Lena asked, stepping into position. "Temp 104.2. O2 sat 88% on high flow, BP crashing," the lead paramedic said, handing over the tablet. "He collapsed at the airport. TSA called us. No known contacts yet." Lena scanned the screen. Travel history. Kinshasa 3 days ago. Symptoms. Started this morning. She looked at the man's chest rising and falling too fast, heard the rattle in his lungs. "Isolation Wing B," she said. "Full PPE. Nobody touches him without gown, N95, face shield, and double gloves. I want a rapid PCR panel for hemorrhagic fevers, respiratory pathogens, and anything the CDC flagged in the last 72 hours. A resident, young, eager, nervous, stepped forward. "Dr. Marquez, shouldn't we stabilize him here first? Isolation Wing B is across the hall. We could lose time." "We follow protocol," Lena interrupted, her voice colder than the rain outside. "Move him now." The resident hesitated. Another nurse whispered, "She never bends." They moved the patient. Lena followed, her mind already 3 steps ahead. She had them set up the isolation bay in 90 seconds. The airlock hissed as it sealed. The man was behind glass now, hooked to monitors, his vitals flashing red and yellow on the screen. Lena stood outside the glass, watching. She could feel the staff behind her, judging, resenting, calling her paranoid in silence. She didn't care. She'd been called worse. Too rigid, too cold, too strict. Her last performance review said she lacked warmth and struggled with team morale. But protocols didn't need morale. They needed obedience. The patient's O2 sat dropped to 84%. Lena's tablet buzzed. A message from the hospital administrator. "Dr. Marquez, the ER is backed up. We need beds freed. Can we move the isolation case to observation?" She stared at the message. Then she looked at the man behind the glass, his chest heaving, his skin gray under the lights. She typed back, "No." At 10:03 p.m., the lab called. The rapid PCR was negative for the usual suspects. The administrator sent another message. "See? False alarm. Clear the isolation bed." Lena didn't move. Something was wrong. The man's symptoms didn't match the timeline. His fever was too high, too fast, and his eyes, when they opened for a second, looked at her like he was drowning. She ordered a full workup. Blood cultures, additional serology, expanded pathogen screen. The lab tech sighed audibly over the phone. Dr. Marquez, that's going to take hours and cost. Do it, she said, and hung up. By 10:30 p.m., the ER was a pressure cooker. Every bed full, ambulances stacking up outside. The charge nurse approached Lena with barely concealed frustration. We've got a multi-car pileup incoming. We need that isolation bed. Lena shook her head. He stays. Lena. The nurse used her first name like a weapon. You're holding up the entire ER for a maybe. I'm holding it for a certainty, Lena replied. Until I know what he has, he doesn't move. The nurse walked away, muttering something about control freak. At 10:47 p.m., Lena's tablet buzzed again. This time, it was the infectious disease specialist on call, Dr. Patel. His message was short. Marquez, I reviewed the case. You're overreacting. Clear him. She stared at the screen. Then she looked at the isolation bay. The man's temperature had spiked to 105. His breathing was worse. She typed back, No. I'm ordering a level 4 pathogen screen. Her finger hovered over send. Level 4 meant CDC involvement. It meant lockdown protocols. It meant she'd be overruling a specialist without proof. She hit send. At 10:52 p.m., the lights in the ER flickered once, then stabilized. The man in isolation seized. Alarm screamed. Lena ran to the airlock, her heart pounding for the first time that night, and as she reached for the door, her tablet buzzed with a message that made her blood stop. Dr. Marquez, TSA just found 6 passengers from the same flight, all symptomatic, all heading to St. Louis hospitals. Possible outbreak event. The ER smelled like panic before anyone said the word out loud. Lena stood frozen for half a second, long enough to feel the weight of what was coming, short enough that no one noticed. Her tablet screen glowed with the TSA alert. 6 passengers, same flight, symptomatic, scattered across 3 St. Louis hospitals. She tapped her earpiece twice. This is Dr. Marquez, ER attending. I need incident command activated immediately. Possible code orange, multi-site infectious exposure. The operator on the other end hesitated. Dr. Marquez, are you sure? That's a hospital-wide alert? Now, Lena said, her voice sharp as a scalpel. Within 90 seconds, the overhead speakers crackled. Attention all staff. Code orange initiated. Incident command to conference room A. Repeat, code orange. The ER went still for a moment, like a held breath. Then chaos unfolded in slow motion. Nurses exchanged glances. A resident dropped a chart. Someone's pager went off 3 times in a row. The charge nurse, Diane, walked up to Lena, her face tight. You just locked down the entire hospital, Diane said, voice low and furious. On a hunch. On 6 patients, Lena corrected, with identical travel history and overlapping symptoms. We don't even know what it is yet. That's why we follow SOP. Diane shook her head, her frustration barely contained. You know what they're going to say, right? That you panicked. That you escalated without evidence. Lena met her eyes. They can say what they want after we contain it. She turned and walked toward the conference room, her footsteps echoing in the hallway. Behind her, she heard Diane mutter, Unbelievable. Conference room A was already filling up. Hospital Administrator Greg Fontaine stood at the head of the table, arms crossed, his expensive suit looking out of place under the fluorescent lights. Dr. Patel, the infectious disease specialist, sat with his laptop open, his expression skeptical. The chief nursing officer, 2 department heads, and the hospital's emergency manager filled the remaining seats. Lena entered last. Every pair of eyes turned toward her. Dr. Marquez, Fontaine said, his tone carefully neutral. You initiated code orange. Walk us through it. Lena set her tablet on the table and pulled up the TSA alert. At 10:52 p.m., TSA flagged 6 passengers from International Flight 447, Kinshasa to St. Louis via Paris. All 6 are presenting with fever, respiratory distress, and rapid symptom onset. 1 is currently in our isolation wing B. The other 5 are en route to St. Mary's, Mercy, and Barnes Jewish. Patel leaned back in his chair. Lena, we already ran a rapid PCR on your patient. Negative for standard respiratory pathogens. Negative for hemorrhagic fevers. Which is why I ordered a level 4 screen, Lena said evenly. Fontaine's jaw tightened. You ordered a level 4 without consulting ID? I consulted the patient's clinical presentation, Lena replied. Fever of 105, hypoxia, altered mental status, and a travel history that matches an active WHO watch zone. Patel shook his head. Lena, do you have any idea what a level 4 screen costs? What it involves? You're talking about CDC notification, potential quarantine protocols, media exposure. I'm talking about containment, Lena interrupted. If this is an outbreak, we have a narrow window to stop transmission. Every minute we wait is a risk. Fontaine rubbed his temples. Dr. Marquez, I appreciate your diligence, but we can't afford to cry wolf. If this turns out to be nothing, then we followed protocol and protected the public, Lena said, her voice firm. If it's something and we didn't act, we're responsible for every case that follows. Silence filled the room. The emergency manager, a woman named Carla with 20 years of disaster response experience, tapped her pen on the table. She's right. SOP says we escalate on travel history plus symptom clusters. 6 patients qualifies. Fontaine's expression darkened, but he nodded. Fine. We proceed with containment protocols. But Marquez, if this turns out to be seasonal flu or pneumonia, you and I are going to have a very long conversation. Lena didn't blink. Understood. Patel leaned forward. All right. Assuming we treat this as real, what's the exposure map? Lena pulled up a diagram on the screen. Patient 0, our isolation case, arrived at the airport at 6:15 p.m. He collapsed in the TSA line at 8:30. EMS transported him here at 9:45. That's a 2-hour window in a public space plus the flight itself. We're looking at potential exposure to airport staff, TSA agents, passengers in the terminal, EMS crew, and anyone in our ER waiting room between 9:45 and 10 how. Carla wrote rapidly. How many people in the ER at that time? Diane, who had followed Lena into the room, checked her log. 12 in the waiting room, 4 staff at triage, 2 security guards. Contact tracing starts now, Carla said. I want names, phone numbers, and exposure duration for everyone. Fontaine looked at Lena. What about the other 5 patients? I've sent alerts to the other hospitals, Lena said. I'm recommending they isolate immediately and share clinical data. We need to know if there's a pattern. Patel's phone buzzed. He glanced at it and his face changed. St. Mary's just reported. One of their incoming patients coded in the ambulance. They intubated in the field. The room went cold. Fontaine stood. All right, we're in full containment mode. Lena, you're the ER lead on this. Patel, coordinate with the CDC. Carla, activate the hospital's emergency operations plan. Diane, I need your staff prepped for extended shifts and PPE compliance. Everyone moved at once. Lena stayed behind for a moment, staring at the map on the screen. 6 patients, 1 flight, a 2-hour window. Her tablet buzzed. A message from the lab. Level 4 screen initiated. CDC notified. Results in 6 hours. 6 to 8 hours. In that time, this could spread to dozens, hundreds. She walked back to the ER. The atmosphere had shifted. Staff moved with purpose now, pulling PPE from supply closets, setting up additional isolation stations. But she could still feel the resentment, the whispers. A young nurse, fresh out of school, approached her nervously. Dr. Marquez, what do I tell patients in the waiting room? They're asking why we're setting up barriers. Lena looked at the waiting room. 12 people, tired, sick, scared. None of them knew yet. Tell them we're taking extra precautions, Lena said, and that they're safe. The nurse nodded and walked away. Diane appeared beside her. You really think this is it? The big one? Lena didn't answer immediately. She watched the monitors in isolation wing B. Patient Zero's vitals were deteriorating. His oxygen saturation was 79%, even on maximum support. I think, Lena said quietly, that we're about to find out. At 11:34 p.m., the second patient arrived from the airport, then the third. By midnight, St. Louis Memorial had 4 patients in isolation, all from Flight 447, all crashing fast. And at 12:07 a.m., Lena's tablet lit up with a message that made her stomach drop. Dr. Marquez, TSA just reviewed airport footage. Your patient 0 had close contact with 43 people in the terminal. We're pulling names now. But there's a problem. 6 of them boarded connecting flights before we could stop them. The ER felt smaller at 12:15 a.m., like the walls were closing in with every new alert. Lena stood at the charge desk, her tablet glowing with a cascade of notifications. 6 passengers on connecting flights. 43 contacts in the terminal. 4 patients crashing in isolation. The math was exponential now, spreading faster than anyone could track. She rubbed her eyes, felt the grit of exhaustion, then forced herself to focus. Her father used to say that the moment you stop counting is the moment people die. So she kept counting. Dr. Marquez, a voice said behind her. It was Patel, his face pale under the fluorescent lights. CDC just called. They're sending a team, but they won't be here until 6 a.m. We're on our own until then. Lena nodded. What about the level 4 results? Still processing. They're prioritizing it, but the earliest we'll know is 4 a.m. 4 hours. She could feel time slipping through her fingers like water. Diane appeared, clipboard in hand, her earlier anger replaced by grim determination. We've got a problem. 2 of the ER nurses who triaged patient 0 are showing symptoms. Low-grade fever, headache, fatigue. Lena's pulse quickened, but her voice stayed steady. Pull them immediately. Isolation protocol. Full workup. Already done, Diane said. But Lena, if staff are getting sick this fast, then we assume it's airborne and highly contagious, Lena finished. Upgrade PPE requirements. N95 minimum for anyone in the isolation wing. Face shields mandatory. And I want a staffing rotation. No one works more than 4-hour shifts in the hot zone. Diane made notes, then paused. You know this is going to get worse before it gets better, right? Lena met her eyes. I know. At 12:43 a.m., Fontaine called an emergency briefing. The conference room felt different now. Tense, urgent, the air thick with the smell of stale coffee and fear. Carla had pulled up a contact map on the main screen, a web of red dots spreading from the airport like a spider's web. We've identified 38 of the 43 terminal contacts, Carla said, her voice clipped and efficient. 5 are still unaccounted for. Of the 38, 12 are showing symptoms. We've notified them to self-isolate, but we can't enforce it. Fontaine leaned forward. What about the 6 passengers on connecting flights? 2 went to Chicago, 1 to Denver, 3 to smaller regional airports, Tulsa, Little Rock, and Springfield. Carla's pen tapped the table like a metronome. We've alerted those airports and local health departments, but if they're symptomatic and they've already made contact, it's already out, Patel said quietly. We're looking at a multi-state event. The room went silent. Lena could hear the hum of the ventilation system, the distant sound of a monitor alarm, the creak of someone's chair. Fontaine broke the silence. All right, we can't control what's happening outside our walls, but we can control what happens here. Marquez, what's the status of our isolation capacity? We have 4 patients currently in Isolation Wing B, Lena said. We can fit 2 more at maximum capacity. After that, we'll need to convert additional spaces. Where? Fontaine asked. Lena pulled up the hospital floor plan on her tablet. The old pediatric wing. It's been closed for renovations, but the negative pressure system is still functional. We can convert 6 rooms in under 2 hours. Do it, Fontaine said. What else? We need to restrict ER access, Lena said. Right now, anyone can walk through those doors. If this is airborne, every person in the waiting room is a potential vector. I'm recommending we implement a screening checkpoint at the entrance. Temperature checks, travel history, symptom assessment. Anyone who flags gets diverted to a separate intake area. Patel frowned. That's going to create a bottleneck. We're already at capacity. Better a bottleneck than an outbreak inside the hospital, Lena replied. Fontaine hesitated, then nodded. Do it. What about the staff who are symptomatic? Quarantined, Lena said. I want daily testing for everyone who had contact with patient 0. And I'm recommending prophylactic antivirals if the CDC clears it. Antivirals for what? Patel asked. We don't even know what we're dealing with yet. Lena looked at him. Then we prepare for the worst and hope for the best. At 1:17 a.m., Lena stood outside Isolation Wing B, watching through the glass as a respiratory therapist adjusted patient 0's ventilator settings. His oxygen saturation had dropped to 72%. His skin had a grayish tint, his chest rising and falling in shallow, desperate gasps. She'd seen death before, too many times. But this felt different, faster, hungrier. A resident named Marcus approached her, his face mask slightly askew. Dr. Marquez, the family of patient 3 is demanding to see him. They're in the waiting area and they're getting loud. Lena turned. Tell them no. Explain the quarantine protocol. I tried, Marcus said. They're threatening to call a lawyer. Lena walked to the waiting area, her footsteps echoing in the hallway. The air smelled like rain and anxiety. A woman in her 50s stood near the desk, her face red, her voice sharp. I don't care about your protocols, the woman said, pointing at Diane. That's my husband in there, and I have a right— Ma'am, Lena interrupted, her voice calm but firm. I'm Dr. Marquez, the attending physician. I understand you're scared, but your husband is in isolation because we believe he may have a highly contagious illness. If you go in there without proper protection, you could get sick. And if you get sick, you could spread it to others. I can't allow that. The woman's anger faltered, replaced by something raw. Is he going to die? Lena paused. The truth was, she didn't know, but lying wouldn't help either. We're doing everything we can, Lena said. But right now, the best thing you can do for him, and for yourself, is to stay here, let us work, and answer any questions we have about his travel history. The woman's shoulders sagged. She nodded, tears streaming down her face. Lena turned to Marcus. Get her information, full contact trace, and check her temperature. At 1:55 a.m., Lena's tablet buzzed with a message from the lab. She opened it, her heart pounding. Preliminary cultures from patient 0 showing unusual viral morphology, not matching any known respiratory pathogens. Recommending immediate CDC consultation. She forwarded it to Patel, then walked back to the conference room. Fontaine was still there, pacing, his tie loosened, his face drawn. "We've got preliminary lab results," Lena said. "It's viral. Unknown strain." Fontaine stopped pacing. "Unknown? The lab can't identify it. Which means it's either new or it's something rare that we haven't seen in this region before." "Jesus," Fontaine muttered. He ran a hand through his hair. "All right, what's our next move?" "We wait for the CDC," Lena said, "and we keep everyone contained." At 2:14 a.m., the 5th patient arrived, then the 6th. By 2:30, the converted pediatric wing was filling up. Lena moved between rooms, checking vitals, reviewing charts, her mind running on fumes and adrenaline. A nurse named Sarah stopped her in the hallway. "Dr. Marquez, I just want you to know, I thought you were overreacting earlier, but you weren't. You saved lives tonight." Lena didn't know how to respond. She nodded once, then kept walking. At 3:02 a.m., her tablet buzzed again. This time, it was a message from Carla. "Dr. Marquez, we found the 5 unaccounted contacts. 4 are symptomatic. 1 is missing. Last known location, downtown St. Louis near the convention center. There's a medical conference happening there tonight. 800 attendees." Lena stopped in the middle of the hallway, her blood turning cold, and for the first time that night, she felt the weight of what was coming crash down on her like a wave she couldn't stop. The convention center was 12 blocks away. 12 blocks and 800 doctors, nurses, and medical professionals packed into conference halls, shaking hands, sharing meals, breathing the same air. Lena stared at the message on her tablet, her mind racing through infection models she'd studied in residency. 1 symptomatic person in a crowd of 800. Airborne transmission. Incubation period unknown. She called Carla. "Do we have a name? A photo?" "Working on it," Carla said, her voice tight. "TSA is pulling passport records now. But Lena, even if we ID them, we can't just shut down a medical conference without proof. The optics alone." "I don't care about optics," Lena said. "I care about containment. Get me a name in the next 10 minutes or I'm calling the convention center myself." She hung up before Carla could respond. Diane appeared at her shoulder, holding a tablet. "Patient 2 just seized. We're losing him." Lena ran. The isolation wing smelled like sweat and disinfectant, the air pressure difference making her ears pop as she passed through the airlock. Patient 2 was a man in his 30s, fit, no prior medical history. Now he was convulsing on the bed, his monitors screaming, his vitals crashing. "Push lorazepam, 2 milligrams, Lena ordered, pulling on double gloves. "And get me a crash cart in here." The nurse moved fast, injecting the medication through the IV. The seizure slowed, then stopped. But patient 2's oxygen saturation kept dropping, 68, 65, 62. "He's not responding to the vent," the respiratory therapist said, his voice muffled behind his N95. "I've maxed out the settings." Lena looked at the monitor. Heart rate 132, blood pressure 88/52, oxygen 61%. She could intubate him deeper. Try ECMO. But the truth was staring at her from the screen. Whatever this was, it was killing faster than they could treat. "Keep him stable as long as you can," Lena said quietly. "And document everything." She stepped out of the airlock, stripped off her PPE, and scrubbed her hands until they were raw. Her tablet buzzed. "Carla. Got him. Dr. Victor Osi. Ghanaian national, attending physician, registered for the medical conference. Last seen checking into the Marriott downtown at 7 p.m. He attended the opening reception from 8 to 10 p.m. Lena's stomach dropped. 2 hours in a crowded ballroom. She pulled up the conference schedule. Opening reception, 650 attendees confirmed. She called Fontaine. "We need to issue a public health alert. Now." "Lena, we can't." 650 people were in a room with a potential carrier for 2 hours, Lena said, her voice sharp. "If we don't act now, this spreads beyond our control." Silence on the other end. Then, "I'll call the mayor's office." At 3:34 a.m., the hospital's public information officer issued an alert. Anyone who attended the medical conference opening reception was advised to self-monitor for symptoms and contact their healthcare provider immediately. Within minutes, Lena's phone started ringing. News outlets, conference organizers, panicked doctors. She ignored them all and focused on the isolation wing. 7 patients now, all critical, all deteriorating. Patel found her at the nurse's station, his face grim. "Lena, I just got off the phone with the CDC. They've reviewed the preliminary cultures. They think it might be a variant of a Marburg-like virus." Lena's blood went cold. Marburg was a hemorrhagic fever, one of the deadliest pathogens on Earth. Mortality rate up to 88%. No cure, no vaccine. "Are they sure?" she asked. "Not yet, but the viral morphology matches. And the symptom progression? Fever, respiratory collapse, multi-organ failure. It fits. Lena looked through the glass at patient 0. His eyes were half open, staring at nothing. Blood had started seeping from his nose. If it's Marburg, she said slowly, then everyone in this hospital who's had contact is at risk. I know, Patel said. The CDC is expediting the results. We should know by 5 a.m. 2 more hours. Lena closed her eyes, felt the exhaustion pulling at her like gravity. At 3:51 a.m., a security guard radioed from the front entrance. Dr. Marquez, we've got a situation. A man just collapsed outside the ER. He's symptomatic, high fever, difficulty breathing, and he's got a conference badge around his neck. Lena ran. The rain had stopped, leaving the air cold and damp. The man lay on the pavement, his chest heaving, his conference badge swinging from a lanyard. Dr. Victor Osei, internal medicine, Accra Teaching Hospital. She knelt beside him, checking his pulse. Rapid and thready. His skin was burning to the touch. Get a gurney, she shouted. Full PPE, isolation protocol. Move! They wheeled him inside, straight to the converted pediatric wing, patient 8. As they hooked him up to monitors, Lena noticed something. A faint rash spreading across his chest and arms, petechial hemorrhaging, classic Marburg. She stepped back, her mind flashing to medical school lectures. Marburg was transmitted through bodily fluids, blood, saliva, vomit, but this was spreading too fast for fluid contact alone. Either the CDC was wrong about the variant, or this strain had mutated into something worse. At 4:12 a.m., Fontaine gathered the command team again. Everyone looked hollowed out, running on caffeine and fear. The mayor's office is getting hammered, Fontaine said. News crews are camped outside. Social media is blowing up. People are scared. They should be, Lena said bluntly. We have 8 patients in critical condition, 2 staff members symptomatic, and a possible exposure event involving 650 medical professionals. If this is what the CDC thinks it is, we're looking at a mortality rate above 80%. Carla swore under her breath. Diane looked like she might be sick. Patel leaned forward. Lena, if it is Marburg, we need to escalate containment protocols immediately. That means full hospital lockdown. No one in, no one out until we can confirm who's been exposed. Fontaine's face went pale. A lockdown? Do you know what that means? We have patients in labor, post-op surgeries, people on dialysis, and if we don't lock down, we have an outbreak, Lena said, her voice steady. I know it's extreme, but we're past the point of half measures. Fontaine stared at her for a long moment. Then he nodded. All right, prepare for a lockdown, but I need confirmation from the CDC first. At 4:47 a.m., Lena stood in the hallway outside the isolation wing watching the monitors. Patient 2 had just died. Patient 5 wasn't far behind. The staff moved like ghosts, exhausted, terrified, but still working. Her tablet buzzed. A message from an unknown number. Dr. Marquez, this is Dr. Rebecca Chen, CDC Epidemic Intelligence Service. I'm reviewing your case files. I need to speak with you immediately. Call me. Lena dialed. The voice on the other end was clipped. Urgent. Dr. Marquez, I've reviewed your patient data and the preliminary cultures. I need you to listen very carefully. What you're dealing with is not Marburg. Lena's heart skipped. Then what is it? We don't know yet, but the transmission pattern doesn't match any known hemorrhagic fever. It's spreading too fast, and the symptom onset is too rapid. We think this might be an engineered pathogen. The floor seemed to tilt under Lena's feet. Engineered? I mean someone made this, Doctor, Chen said. And if that's true, then this isn't just an outbreak. It's an attack. The word attack hung in the air like smoke. Lena stood frozen in the hallway, her phone pressed to her ear, the fluorescent lights buzzing overhead. Around her, the hospital hummed with controlled chaos. Monitors beeping, footsteps echoing, the hiss of airlock doors, but all she could hear was Dr. Chen's voice. An engineered pathogen, Lena repeated, her mouth dry. You're saying this was deliberate? We can't confirm yet, Dr. Chen said, but the genetic markers we're seeing don't occur naturally. The incubation period is too short, the transmission rate is too high, and the symptom progression, it's like someone took the worst parts of multiple diseases and combined them. Lena's mind raced. Who would do this? And why target a flight from Kinshasa? That's what we're trying to figure out. The FBI is involved now. But Dr. Marquez, here's what matters for you. If this is engineered, then standard containment protocols may not be enough. You need to assume worst-case scenario. Airborne transmission, high mortality, and possible secondary attacks. Secondary attacks? Lena's pulse quickened. If someone released this once, they could do it again. Different location, different vector. You need to lock down your hospital immediately and prepare for the possibility that you're not the only target. The call ended. Lena stood there, her hands shaking, then forced herself to move. She found Fontaine in the conference room, his face buried in his hands. "Greg," she said, "we need to lock down. Now." He looked up. "The CDC confirmed it?" "They confirmed it's not natural," Lena said. "They think someone engineered this, which means we're not just dealing with an outbreak. We're dealing with a bioterror event." The room went silent. Carla stopped mid-keystroke. Patel's face drained of color. Fontaine stood slowly. "Are you absolutely sure?" "The CDC is," Lena said, "and they're recommending immediate lockdown protocols. No one in, no one out, until we can identify every exposure point." Fontaine walked to the window, staring out at the parking lot. Dawn was still an hour away, but the news vans were already lining up, their satellite dishes pointing skyward like accusing fingers. "All right," he said quietly. "Initiate code Silver. Full lockdown." At 5:03 a.m., the hospital's intercom crackled to life. "Attention all staff and visitors. St. Louis Memorial is now under code Silver lockdown. All entrances and exits are secured. No one may enter or leave the building until further notice. This is not a drill." The reaction was immediate. Patients in the waiting room stood, confused and angry. Staff exchanged worried glances. Security guards moved to block the doors, their faces tense. Lena watched from the ER as a woman with a crying baby pounded on the glass entrance doors. "Let me out! I need to get home!" A security guard spoke into his radio, his voice strained. "Dr. Marquez, we've got multiple people trying to leave. Some are getting aggressive." "Hold the line," Lena said. "No exceptions." She walked to the main entrance, her white coat streaked with sweat and exhaustion. The woman with the baby was still pounding, her face red with fury and fear. Lena pressed the intercom button. "Ma'am, I know you're scared, but we have reason to believe there's been an exposure to a dangerous pathogen inside this hospital. If you leave now, you could be carrying it. You could spread it to your family, your neighbors, your child. I need you to stay calm and let us do our job." The woman's pounding slowed, then stopped. She looked at her baby, then back at Lena. "How long?" "I don't know," Lena said honestly, "but we're doing everything we can." At 5:19 a.m., Diane found Lena at the charge desk. "We've got a problem. 3 nurses are refusing to work. They're scared and they're talking about walking out." "They can't," Lena said. "We're in lockdown." "I know, but they're saying you don't have the right to keep them here against their will. One of them is threatening to call a lawyer." Lena rubbed her temples. She could feel a headache building behind her eyes, sharp and insistent. "Where are they?" "Break room." Lena walked to the break room. 3 nurses sat at a table, their faces pale and defiant. One of them, a woman named Kelly, stood when Lena entered. "Dr. Marquez, you can't do this. We have families. We have kids at home." "I know," Lena said, "and I'm sorry. But if you leave now, you could bring this home to them." "We didn't sign up for this," Kelly said, her voice rising. "We're nurses, not soldiers. We didn't agree to die for this job." Lena felt something crack inside her. She was so tired of being the bad guy, the strict one, the one everyone resented. But she couldn't stop now. "You're right," Lena said quietly. "You didn't sign up for this, none of us did. But here's the truth. 8 people are dying down the hall. 2 of our own staff are symptomatic. And if we walk away, more people will die. Maybe hundreds, maybe thousands. So I'm not asking you to be soldiers. I'm asking you to be what you already are. Nurses. The people who show up when it's hard, when it's scary, when no one else will." Kelly's eyes filled with tears. She looked at the other 2 nurses, then back at Lena. "What if we get sick? Then we'll take care of you," Lena said. "Just like you're taking care of them?" After a long moment, Kelly nodded. The other 2 followed. At 5:34 a.m., Lena's tablet buzzed with the CDC results. She opened the file, her hands trembling. The genetic analysis was dense, full of technical jargon, but one sentence stood out. "Pathogen exhibits characteristics consistent with synthetic bioengineering. Origin unknown. Recommend immediate federal investigation." She forwarded it to Fontaine and Patel, then leaned against the wall, her legs suddenly weak. Engineered. Someone had created this. Someone had put it on a plane. Someone had turned 800 people into potential carriers. Her tablet buzzed again. A message from Dr. Chen. "Dr. Marquez, FBI is reviewing passenger manifests from Flight 447. We may have a person of interest. Sending you a photo now." The photo loaded. A man in his 40s, thin face, wire-rimmed glasses, unremarkable. The caption read, "Dr. Elias Conte, microbiologist, last known employer, Biogen Solutions, Kinshasa. No current address. Flagged for questioning." Lena stared at the photo. This was the face of the person who might have started all of this, who might have killed 8 people and counting. Her phone rang. It was Carla. "Lena, we've got a hit." Security footage from the airport shows Dr. Conte meeting with someone in the terminal. A woman, mid-30s, blonde hair. They talked for 3 minutes. Then she left. "We're trying to ID her now." "Where did she go?" Lena asked. "We don't know. She's not on any flight manifests." But Lena, she was carrying a briefcase, and airport scanners flagged it for biological materials. Lena's blood turned to ice. "So there could be more. We're working on it. But if she's still in St. Louis, then we need to find her," Lena said, before she releases it again. At 5:52 a.m., the sun began to rise over St. Louis, casting pale light through the ER windows. Lena stood at the glass, watching the city wake up, unaware of what was happening inside these walls. She thought about the woman with the briefcase, about Dr. Conte, about the 800 people at the medical conference who might already be infected. If you've ever been the one who had to make the hard call when everyone else wanted to quit, comment, "I stayed, so I know you understand what it costs." Her tablet buzzed one more time. A message from the lab: "Patient 0 deceased. Time of death, 5:47 a.m. Cause: multi-organ failure secondary to unknown viral hemorrhagic syndrome." Lena closed her eyes. The first death, but not the last. At 6:01 a.m., the hospital's intercom crackled again. But this time, it wasn't Fontaine's voice. It was someone else. Distorted, electronic, wrong. "Attention St. Louis Memorial," the voice said. "You have 12 hours to release Dr. Elias Conte into federal custody, or the second release will occur. This is not a negotiation. The clock starts now." The distorted voice echoed through the hospital like a ghost. Lena's blood turned cold. Around her, staff froze mid-step. Patients looked up from gurneys, and the ER fell into a silence so complete she could hear her own heartbeat hammering in her ears. "Attention St. Louis Memorial," the voice repeated, crackling through every speaker in the building. "You have 12 hours to release Dr. Elias Conte into federal custody, or the second release will occur. This is not a negotiation. The clock starts now." Then static. Then nothing. Lena ran to the security office, her feet pounding against linoleum. Fontaine was already there, along with 2 security guards and a hospital IT tech named Marcus, who looked like he might pass out. "How did they get into our system?" Fontaine demanded, his face red. Marcus's hands shook as he typed. "I don't know. Our PA system is supposed to be isolated from external networks. They'd need physical access to the server room or—" He stopped, his eyes widening. "Or they're already inside the building." The room went silent. Lena's mind raced. Pull security footage. Every entrance, every hallway, every stairwell. If they're inside, we need to find them now. "Dr. Marquez," one of the security guards said, his voice tight. "If they're inside and they have another release, then we're all exposed," Lena finished, "which is why we find them first." Fontaine grabbed his phone. "I'm calling the FBI. They need to be here now." At 6:14 a.m., the hospital felt like a pressure cooker. Staff whispered in clusters. Patients asked questions no one could answer. Lena moved through the ER, checking on the isolation wing, trying to project calm while her mind screamed with scenarios. 12 hours? One more release? How many more would die? Patel intercepted her near the airlock. "Lena, I just got word from the other hospitals. St. Mary's has 3 patients from the conference in critical condition. Mercy has 2. And Barnes Jewish just admitted 4 more. How many total?" Lena asked. "Across the city? 16 confirmed cases. 8 dead. 8 dead." The number hit her like a punch. "And we still don't know where Dr. Conte is," Patel continued, "or who his accomplice is. The FBI is reviewing footage, but—" "We don't have time for but," Lena said. "We need answers now." At 6:29 a.m., Carla burst into the command center, her face pale. "We found her. The woman with the briefcase." She pulled up security footage on the main screen. A woman in her mid-30s, blonde hair pulled back, wearing a dark coat and carrying a silver briefcase. She walked through the airport terminal with purpose, her face partially obscured by a scarf. "Facial recognition came back," Carla said. "Her name is Dr. Nadia Volkov. She's a virologist. She worked with Dr. Conte at Biogen Solutions until 6 months ago, when they both disappeared." Lena leaned closer to the screen. "Where is she now?" "That's the problem," Carla said. "We lost her after she left the airport. No credit card usage, no phone pings, nothing. She's a ghost." Fontaine paced. "So we have 2 bioterrorists, one of them inside our hospital, and 12 hours before they release another pathogen. Does anyone have good news?" No one answered. At 6:47 a.m., Lena returned to the isolation wing. Patient 5 had just died. The staff moved mechanically, documenting vitals, updating charts, their eyes hollow with exhaustion and fear. She found Diane sitting in the break room staring at her hands. "You should rest," Lena said. Diane laughed bitterly. "Rest? Lena, we're locked in a hospital with a terrorist, a biological weapon, and a ticking clock. I don't think I'll ever rest again." Lena sat beside her. For a moment, neither spoke. The break room smelled like burnt coffee and fear. "I've been thinking," Diane said quietly, "about what you said earlier, about following protocol. I used to think you were just rigid, cold, but now I get it. You weren't being mean. You were being ready." Lena didn't know how to respond. She'd spent years being resented for her strictness. Hearing this now in the middle of a crisis felt surreal. "I wasn't ready for this," Lena admitted. "No one could be. But you didn't panic," Diane said. "When everyone else wanted to ignore it, you pushed. You followed the SOP, and because of that, we're still standing." At 7:02 a.m., Marcus from IT found Lena in the hallway. "Dr. Marquez, I traced the PA system hack. They accessed it from a terminal in the old pediatric wing, the one you converted into isolation rooms." Lena's stomach dropped. "They're in the hot zone?" "Or they were," Marcus said. "The terminal hasn't been used since 6:01 a.m., but whoever it was knew our system. They had admin credentials." "Who has those credentials?" Lena asked. "Hospital administrators, department heads, IT staff, and—" Marcus hesitated. "And Dr. Patel. He was granted emergency access last year during the ransomware attack." Lena's blood went cold. "Where is Patel now?" "I don't know," Marcus said. Lena ran. She checked the conference room. Empty. The isolation wing. No sign of him. She radioed security. "I need eyes on Dr. Patel. Now." Static. Then a voice. "Dr. Marquez, we found him. He's in the old server room, basement level." Lena took the stairs 2 at a time, her heart pounding. The basement was cold and damp, smelling like mildew and old concrete. The server room door was ajar, light spilling into the hallway. She pushed it open. Patel stood at a computer terminal, his back to her. On the screen, security footage, patient files, and a messaging window with text in a language Lena didn't recognize. "Patel," Lena said, her voice steady despite the adrenaline flooding her system. "Step away from the terminal." He turned slowly. His face was calm, almost sad. "Lena, I was hoping it wouldn't come to this." "Come to what?" Lena asked, her hand moving to her phone. "You were never supposed to catch it this early," Patel said. "The protocol was supposed to fail. The patients were supposed to spread it before anyone realized. But you," he shook his head, "you followed every rule. You pushed when you should have waited. You ruined everything." Lena's mind reeled. "You're working with them, with Conte and Volkov." "Not with them," Patel said. "For them. Do you have any idea how broken our healthcare system is, Lena? How many people die every year because hospitals prioritize profit over protocol? Biogen wanted to expose that, to force a reckoning. By killing people?" Lena's voice shook with anger. "By proving that even the best hospitals can fail," Patel said. "But you didn't fail. You locked down. You contained it. And now they're going to release the second strain, and everything we worked for will be wasted." "Where's Volkov?" Lena demanded. Patel smiled. "You'll never find her in time." Lena lunged for the terminal, but Patel was faster. He slammed a command key and the screen went black. Alarms blared. The lights in the basement flickered. "What did you do?" Lena shouted. "I gave them what they wanted," Patel said. 12 hours was never the real deadline. It was a distraction. The second release is already happening. At 7:23 a.m., Lena dragged Patel to the security office, her hands shaking with rage and fear. Fontaine and Carla stared at him in disbelief. "Where is the second release?" Fontaine demanded. Patel said nothing. Lena leaned close. "People are dying because of you. Our people. If you ever had any humanity left, tell us where she is." Patel looked at her, his eyes empty. "The ventilation system," Carla's face went white. "The hospital's HVAC?" Patel nodded. "Volkov planted aerosolized canisters in the main air handlers. They're set to release at noon. By the time you find them, everyone in this building will be exposed." The words hung in the air like a death sentence. Lena stared at Patel, her mind trying to process what he'd just said. Aerosolized canisters, main air handlers, noon. She glanced at the clock on the wall. 7:26 a.m. 4 hours and 34 minutes. "How many canisters?" Carla demanded, her voice sharp. Patel shrugged. "I don't know. Volkov handled the placement. 3, maybe 4. Enough to saturate the entire hospital." Fontaine slammed his fist on the desk. Where are the air handlers? Give me locations. Roof, basement, mechanical room, and the east wing utility shaft, Patel said, his voice flat. But they're rigged. If you tamper with them wrong, they'll release immediately. Lena's stomach turned. A booby trap. Of course it was. Call the FBI, she said to Fontaine. And get a bomb squad here. We need specialists. They're 20 minutes out, Fontaine said, already dialing. We don't have 20 minutes to waste. Lena turned to Carla. Pull up the HVAC schematics. I need to see every access point, every duct, every handler. Carla's fingers flew across the keyboard. Within seconds, a blueprint of the hospital's ventilation system filled the screen, a maze of ducts, vents, and air handlers snaking through the building like arteries. There, Carla said, pointing. 3 main air handlers, one on the roof, one in the basement, one in the east wing mechanical room. If she planted canisters in all 3, then we have to disarm all 3 simultaneously, Lena finished. Or she could trigger them remotely the moment we touch one. Diane appeared in the doorway, breathless. Lena, we've got patients asking what's going on. The alarms, the lockdown, they're scared. Keep them calm, Lena said. Tell them we're handling a maintenance issue. Don't mention the canisters. And if they ask why we can't leave, tell them the truth, Lena said. That leaving right now would put them in more danger. At 7:41 a.m., the FBI arrived. 2 agents in dark suits, followed by a bomb technician named Hayes, who carried a heavy kit and wore an expression of grim focus. Fontaine briefed them in 30 seconds flat. Hayes studied the HVAC schematics, his jaw tight. This is sophisticated. If they're rigged with anti-tamper devices, one wrong move and we're all breathing weaponized pathogen. Can you disarm them? Lena asked. Maybe, Hayes said. But I need time to assess each device. And I need to know what kind of trigger we're dealing with. Mechanical, electronic, or remote. Patel spoke from the corner, his hands zip-tied behind his back. Remote. Volkov has a transmitter. She can trigger them from anywhere within a mile radius. Hayes swore under his breath. So even if we find the canisters, she can blow them before we disarm them. Not if we jam her signal, Carla said. She pulled up another screen. We can flood the hospital with a broadband jammer. It'll kill all wireless signals, phones, radios, everything, but it'll also block her transmitter. Do it, Fontaine said. Wait, Lena interjected. If we jam all signals, we lose communication. We won't be able to coordinate between teams. Then we go old school, Hayes said. Runners, walkie-talkies on hardline. We adapt. At 7:52 a.m., Carla activated the jammer. Every phone in the hospital went dead. The Wi-Fi dropped. Monitors that relied on wireless connections flickered. Staff looked around, confused, but Lena had already sent runners to every department with instructions. Continue patient care, stay calm, follow orders. Hayes assembled 2 teams. One would tackle the roof handler. One would take the basement. Lena volunteered for the 3rd, the East Wing mechanical room. Absolutely not, Fontaine said. You're the ER attending. We need you here. You need someone who understands medical protocols in case there's exposure, Lena countered. And I'm the only one who's been in the hot zone all night. I know what we're dealing with. Fontaine hesitated, then nodded. Fine, but you follow Hayes's lead. No heroics. Lena pulled on PPE, N95, face shield, double gloves. The mechanical room was in a part of the hospital she rarely visited, a warren of pipes and machinery that smelled like oil and dust. Hayes went in first, his flashlight cutting through the darkness. There, he said, pointing. A silver canister, no bigger than a thermos, sat attached to the main air duct. Red and green wires snaked from its base to a small electronic device, the trigger. Hayes knelt, his hands steady. This is military grade. Pressure sensor, anti-tamper switch, and a wireless receiver. If I cut the wrong wire, or if Volkov sends the signal, we're exposed, Lena finished. Hayes nodded. He pulled out a small tool, studied the wiring, then carefully clipped a green wire. Nothing happened. He exhaled slowly and clipped a second wire. The red light on the device blinked once, then went dark. Done, he said. 1 down. Lena's radio crackled. Roof team reporting. Canister located. Disarming now. At 8:17 a.m., the basement team radioed in. We've got a problem. There's no canister here. Lena's blood ran cold. Say again? No canister. The basement handler is clean. Hayes looked at Lena. Patel said 3 locations. Roof, basement, east wing. He lied, Lena said. She ran back to the security office, her heart pounding. Patel sat in the corner, a faint smile on his face. Where's the 3rd canister? Lena demanded. I told you, Patel said. Basement. There's nothing there, Lena said. Where is it really? Patel's smile widened. You'll figure it out, or you won't. Lena grabbed him by the collar, her rage boiling over. People are dying because of you. If you have any shred of decency left— Decency? Patel laughed bitterly. You want to talk about decency? You who spent years being called too strict, too cold, because you followed every rule without question? I used to admire that about you, Lena. But then I realized, you're not strict because you care. You're strict because you're afraid. Afraid of failure, afraid of being wrong, afraid of being human. Lena's hand trembled. She wanted to hit him, to scream, but instead, she forced herself to think. 3 canisters, 2 found, 1 missing. Where would Volkov hide the third? Then it hit her. The isolation wing, Lena said. The old pediatric wing. We converted it last night. Volkov knew we'd move patients there. She planted it in the new isolation area. She ran. The isolation wing was silent. The patients hooked to ventilators, their vitals flashing on screens. Lena scanned the room, her eyes searching for anything out of place. Then she saw it. A small silver canister tucked behind a ceiling vent, barely visible. She radioed Hayes. Found it. Isolation Wing B. I need you here now. Hayes arrived within 2 minutes, his kit in hand. He climbed a ladder, examined the canister, and his face went pale. This one's different, he said. It's got a timer, and it's counting down. Lena looked at the small LED display. 347, 346, 345. Can you disarm it? She asked. I don't know, Hayes said. This is more complex than the others. And if I'm wrong, then we evacuate, Lena said. Clear the isolation wing, seal the doors, and hope the negative pressure holds. That won't be enough, Hayes said. If this goes off, the pathogen will spread through the ducts within minutes. We'd need to shut down the entire HVAC system. Do it, Lena said. At 8:34 a.m., the hospital's ventilation system went silent. The air became still, heavy, oppressive. Patients started sweating. Staff fanned themselves with clipboards. And in Isolation Wing B, Hayes worked on the canister, his hands moving with surgical precision. 212, 211, 210. Lena stood at the door, watching. Her entire career had been built on following protocol, on being prepared, on never letting chaos win. But now, standing here, watching Hayes dismantle a bomb in a room full of dying patients, she realized something. Protocols could only take you so far. At some point, you had to trust people, trust their skill, trust their courage, trust that they'd do the right thing, even when the rules ran out. 103, 102, 101. Hayes clipped the final wire. The timer stopped at 0:47. He looked at Lena, his face drenched in sweat. We're clear. Lena's knees almost gave out. She leaned against the wall, her heart pounding, and for the first time that night, she let herself feel the weight of everything. The fear, the exhaustion, the impossible responsibility of keeping everyone alive. At 8:52 a.m., Fontaine gathered the command team. All 3 canisters are secured. FBI is taking Patel into custody, but we still don't have Volkov. She's still out there, Lena said, and she knows we stopped her. As if on cue, a runner burst into the room. Dr. Marquez, there's someone at the front entrance. She says she needs to speak to you, and she's carrying a briefcase. Lena's blood ran cold when she heard Volkov had returned and was asking for her. Ignoring Fontaine's protests, she went down to the entrance with an FBI agent on a wire. Volkov stood outside, calm, holding a silver briefcase like leverage. Volkov demanded a private conversation, warning that more releases would follow if Lena didn't listen. Lena allowed her in under strict conditions, the briefcase left outside. In a small conference room, Volkov revealed the truth. The attack wasn't about chaos. It was proof. Proof that hospitals cut corners, ignore protocols, and fail under pressure. The pathogen, she claimed, was designed not to destroy cities, but to expose a broken system. Lena called it what it was: murder. 8 people were dead. Dozens were infected. Volkov argued the deaths were necessary, that the outcome would force reform nationwide. Lena refused that logic. Protocols existed to save lives, not to justify sacrificing them. Volkov offered Lena a choice: join them and help reform the system from within. Lena said no. As she was arrested, Volkov admitted the final threat had been a bluff. There was no 4th release. She only wanted to see if Lena would panic or abandon protocol. She hadn't. That was the proof. Back in the ER, the crisis eased. Staff regrouped. The lockdown remained, but control had returned. Diane told Lena she finally understood. Lena wasn't cold or rigid. She was ready. In the final briefing, it was clear. Early isolation and strict adherence to SOP had prevented catastrophe. This hadn't been luck. It had been preparation. Marcus, the resident who had doubted her, apologized. Lena told him questioning was healthy, but once a decision was made, the team had to commit together. Outside the isolation wing, Lena watched the survivors. 5 had died. 7 were still fighting. The cost weighed on her. A final message from the CDC confirmed the pathogen was engineered but contained. Deadly, but stopped in time. Lena closed her eyes and finally let herself breathe. Protocols had saved lives. And this time, people understood why being too strict mattered. The sun rose over St. Louis as the hospital slowly exhaled. The immediate threat was over. Patel and Volkov were in federal custody. The lockdown would be lifted in phases. Some staff clapped. Lena didn't. 5 people were dead. 7 were still critical. She stayed at the charge desk, exhausted, refusing to leave until the last unstable patient was safe. The FBI thanked her for containing the outbreak and stopping Volkov. Lena answered the same way every time. She'd followed protocol. But she didn't deny the truth Volkov had pointed out. The system was fragile, understaffed, underfunded, easy to exploit if no one fixed it. The CDC called next. Dr. Chen invited her to consult on a national hospital preparedness task force. Lena realized something then. Being labeled too strict had never been a flaw. It was the reason people were alive. Patients began to leave. Families reunited in the parking lot. From the isolation wing, Lena watched survivors walk away with second chances. Maria, the flight attendant, thanked her personally, not just for saving her life, but for staying calm when fear took over, for insisting on isolation when others wanted shortcuts. In the final command meeting, the numbers were clear. The pathogen had been contained within 16 hours. No secondary spread. Fontaine apologized for doubting her decision to activate Code Orange. Fear, Lena realized, wasn't weakness. It was vigilance. The lockdown officially ended. Media flooded the front entrance. Lena slipped out the side, texted her mother that she was okay, then turned around and went back inside. Patients were still fighting. She wasn't done. Diane told her what others were starting to see. Lena wasn't cold. She was clear, and people would follow that kind of leadership. Watching another patient stabilize, Lena finally agreed to join the CDC task force. Change wouldn't happen by accident. Someone had to push it. As evening fell, she stood on the hospital roof, the city moving on below. They had been tested, and they had survived. Her phone buzzed. A message from Fontaine. Mandatory emergency meeting. Protocols would be reviewed. Changes implemented. Her leadership required. Lena smiled and replied, "I'll be there." They used to call her too strict. Now they understood why that mattered. Morning came too soon. Lena woke exhausted, disoriented, her body still carrying the weight of the crisis. Patel and Volkov were in custody. The pathogen was contained, but the work wasn't done. She returned to St. Louis Memorial as the city moved on, unaware of how close it had come to disaster. News vans still lined the parking lot. Inside, a leadership meeting was already underway. Fontaine asked Lena to lead the discussion. She didn't talk about heroism. She talked about protocols, about timing, about how following procedure, immediately, without shortcuts, had bought them the time they needed to save lives. They'd been prepared, but they'd also been lucky. "What do we change?" Carla asked. "Everything that needs fixing," Lena said. "More isolation capacity, faster labs, clearer communication with federal agencies, adequate staffing, and a culture where caution wasn't treated as paranoia, but professionalism." By mid-morning, action items were set. Emergency funding, mandatory crisis training, direct federal coordination. Lena volunteered to lead the program. Before she left, Fontaine stopped her. He told her he was recommending her for chief of emergency medicine, not because she reacted well under pressure, but because she prevented things from getting worse. Back in the ER, the rhythm felt familiar again. Patients were stabilizing. Staff nodded differently now, with trust. A call from the CDC confirmed the threat might not be over. Other operatives could still be out there. St. Louis Memorial would become the model for national preparedness. Later, Lena called her mother. They spoke about her father, who had died during an outbreak years earlier, about why Lena had chosen this path, about doing the job right, even when it was hard. By afternoon, another trauma rolled in. Routine. Serious, but manageable. Lena worked calmly, precisely, surrounded by a team that trusted her judgment. This, not recognition, not titles, was why she stayed. Before ending her shift, she wrote a detailed incident report. Not for bureaucracy, but for learning. For the next hospital. The next crisis. "You never apologized for being right," Diane joked. "It's not about being right," Lena said. "It's about doing what works." That evening, Lena went home exhausted but steady. The news praised the hospital's response. She turned it off. A message from a resident thanked her for teaching him that protocols weren't about control, but respect for patients. for risk, for reality. Lena closed her eyes, finally letting herself rest. They used to call her too strict, until protocols saved lives.